welcome. I'm Tafara Gadamu. Judging by what tertiary level hospitals in Addis Ababa absorb, the figures for children suffering from cancer remain far from negligible. And these children have to undergo weeks and months of treatment before the full course is administered. And here is where institutions like Tesfa Addis Parents Childhood Cancer Organization claim to come in, helping with patients and their parents that often tend to end up bankrupt. Sara Ibrahim, the manager of this organization, joins me for our conversation on this critical but largely undermined health problem. Everyone, welcome to the program.
Okay, thank you.
So many of your patients come on a referral basis, right? Yeah. From primary health care providers.
Actually, they come from the Grambessa Specialist Hospital in St. Paul, and Jimma and Gondar Hospital. We receive them from these hospitals when they are finally, declared that they have cancer.
But these patients don't actually know that they're cancer patients, right? Up until they get the diagnosis.
Yeah, they want to know. They come from, many of them come from the regional states, and in their hospital they are referred to either the Grambessa or St. Paul in Addis, or Jimma University Hospital, or Gondar University Hospital, or Magali, either hospital. That's the point where they know that they have cancer, because there are a lot of investigation done, and after confirming that they have cancer, they will be admitted in a cancer ward, and after that, after investigating that they don't have any support and they are willing to continue treatment, they will be referred to our center.
At what stage during the course of this disease do they make it to this referral hospitals?
It differs. Sometimes at the primary health center, they just refer them within weeks or months, sometimes in a year. It depends on the decision of a doctor at the primary level hospital.
And when they do, quite often they are referred to hospitals primarily in Addis Ababa, right, where the tertiary level healthcare system is available.
Usually when they suspect that a child has cancer, they refer them to Grambessa Hospital or St. Paul. So that's depending on, the level of understanding at the primary health facility.
How young would these children be?
It starts from newborn up to age of 13. That's the pediatrics definition of the Grambessa, but it couldn't go on up to 16 or 18 in adolescent.
When you say regions, you're basically talking about every region, or there are a concentration of cancer patients in a particular region?
In every region.
So do they come en masse? What are the numbers like?
It differs from time to time. So now, if you go to the hospital, all the beds are full. But sometimes when it's harvesting season, or when, they are busy at their home, it reduces. But usually we have 40 to 50 patients every time in the hospital. Every day.
Wow. These are cancer patients?
Yeah, cancer patients.
40 to 50 every day?
Yeah.
Wow. So you said you operate, you have created this link with 4 or 5 institutions across the country, 2 in Addis Ababa, 1 in Jimma, that's Jimma University Hospital, right? Yeah. And 1 in Gondar, Gondar University, right, hospital, and 1 in Mekelle.
Specialized
hospital. When did you start working with? First, I guess you started working with the Black Line Hospital. That's where it all was conceived, right? The whole project, the whole idea, right?
It was in 2012 we started officially, but we started earlier with the parents' engagement. And when we get our license, it was in 2012.
How about the rest? How did you identify this as potential partners?
First, we start with Black Line, ጥቁር አንበሳ, and then to Jimma. It came because pediatric oncology program has started in Jimma University Hospital. There has to be a doctor, and nurses, and a ward dedicated to pediatric oncology. That's how we started. Jimma came second, and then Gondar and Meghale at the same time, right before COVID. But Jimma was like 3 years when we started with Jimma. And now almost 6 years with Jimma University Hospital.
So I want to look into how you came into this whole picture. How does it work? The patients come to, for example, to the university hospitals, right? To Black Lion Hospital, and then they give you a call, or how?
No. We have psychologist based in the ward, and they have counseling sessions twice a week. We have a coffee ceremony, and the parents discuss about their issues, and we introduce about our organization, that there is a place they could stay, because cancer takes very long time to treat and get well, the children. So we explain to them what the journey is, and that's how it starts. Then when they are discharged, after maybe 15 days or a month, then we have a referral form with their pictures and everything, and they are sent to our center. We have a service that we rent also for the patients.
Why do they have to stay at your homes? Because they cannot afford, these are parents, right?
Yeah.
They cannot afford to rent a place in Addis Ababa for as long as the treatment goes, right? So they come from very poor, economically disadvantaged populations, correct?
Yes. Sometimes the money they have is not enough, because they sell their cow, they sell their land, and come with a lot of money. But before they come to our center, they will spend it on medication, investigation, and different, activities. Then they become poor. But actually, they have some sort of living back home, but they couldn't stay in Addis because they can't afford to pay for accommodation, meal, and also medication.
Statistically speaking, what would be the percentage of this cohort of parents who cannot afford to continue living like that and need the services of your organization?
Those parents that come to the Black Lion Hospital is usually parents from the rural side, or parents that could not afford, private clinic.
Because it is free.
Yeah, almost. Chemo is free. We have some in the hospital that comes from Addis, but usually it's almost 90%, I would say, from the rural side. Yeah.
So same thing for other regions like Jimma, Meghale, Gondar, and so on.
It is even more.
So you have psychologists and counselors stationed in all these universities?
Yeah.
Okay. And then tell me about your homes. Now, when you talk about parents and patients staying at your homes, you're saying not the parents, not both of them, but just one, right?
Yeah, one parent and one child will stay.
Usually the mother?
Oh, no.
Really?
Yeah, the fathers also.
Okay.
Because in the city, it is easier for the men to understand the city and to go around. So usually the fathers opt to stay. And unless they have a very small child that are breastfeeding, usually it's the fathers that stay in our home.
So what do you provide them with?
We provide them with a place to sleep, meal, all the cleaning facilities are open for them, and psychological support is there. We have for the parents handcraft or skill building activities, and for the children something like schooling, but not really formal schooling, because they are also on chemo and are not feeling well. So it is a sort of relaxing environment. and transportation from the home to the hospital and back. And when they go back also, we provide, we pay for their transportation.
So they stay on the average for months, 3, 4 months, 5 months?
3 months, but sometimes they could stay more than that.
Until they finish the treatment?
When they get 1 month appointment or more than that, then they can go home and come back.
And there are also cases where patients stay at your place, I guess, for a year plus.
Yeah.
These are patients who need to visit the hospital every so often.
Treatment and different like radiation and other things. So they might stay in a year or more. And during the conflict also, some people couldn't go back, so they had to stay in our center.
How many children and parents are we talking about here on the average? Currently, for example, how many of them do you have?
In a day, we can accommodate 50 patients and 50 parents, total 100 people in
at your center, at your home?
In Addis, yeah.
And there is one home, right?
There is one home.
Do you have enough space for all these kids and their parents?
Yeah, it's enough. It is a very old house, and it can accommodate it. It has space, but sometimes when it is more, we even open up, the sitting area and other. Even sometimes we turn the school into a space where they could sleep. So we won't say no, because it is better to stay in our house than spend the night in the hospitals. Even for the children, they don't consider themselves as being sick. They are always happy. Sometimes people come and say, "Are you sure these are cancer patients?" Because they are always playing, they are happy, and they like the environment. Even when they stay in the hospital, we have playrooms, and we have painted the hospital in a very child-friendly picture. So we make sure that they don't feel, the burden. Only when they are given chemo and all this, they feel sad, but they come out of it real quick.
How many of them do actually make it?
Well, it depends on the type of cancer. Recently, there was a study, which is not yet official, but for some 100% survive, for some up to 50 and 65% survive, which is a very good number. When we started, it's like under 20%.
Have you come across patients who've died at your homes? Is that
At our homes? No. Because when it's able to know that when they are very sick, so we admit them in the hospital, and doctors decide that they have to go home, and they'll tell the parents that they have done everything, but this time that they need to go home. So far we haven't encountered, but we know when they die, the parents call us and tell us, and most of the time they thank what we have done.
It was worth a try.
Yeah.
They say that.
Yeah.
And when they go back home to their rural villages, do they tell people to go to seek those services?
We have this...
It's a word of mouth thing? That's
this program, because in our awareness raising program, it's very difficult, to have a lot of media. So we cannot pay for a big awareness campaign. So what we do is whenever a parent go home, we give them the sign and symptom of childhood cancer and also a letter, and to go and teach the community, the health center, and even the local health office. They have like health desk and this, so to disseminate that poster and also talk to the people there. When they come early, it means cure. If they are late, then just palliative care.
Do you also bring back to town survivors, cancer survivors, to kind of talk to cancer patients?
Yeah, we do. We do that, and also the parents also talk to the parents in our coffee ceremony. We invite parents of survivors to talk to the parents that just learned that their kids have cancer.
Do you have enough staff to handle all those?
We have enough, but we use volunteers. Because we use volunteers, then most of the work is done by volunteers, but we have staff that look over, what's going on, so that we won't be off track with volunteers, but we do use a lot of volunteers.
How do they know about the work of your organization?
We have Facebook, and also people come to know when they go to the hospital about our service, and mostly students, like the Rotaract, clubs, and people come. When they come to our center, we tell them that there is a volunteer program, and students usually are very active.
Okay. Who else are these volunteers? That includes professionals as well, right?
Yeah. I mean, if anyone wants to come and volunteer, we have a space for that.
You said that you cannot afford to put together a massive awareness campaign primarily for financial reasons, and I can see that handling this, and for those many years, 10 plus years, is not an easy thing. Where do you source your resources from?
We have a donor that's based in the US, which is called the Aslan Project. That has been established because of an Ethiopian child called Temesgen Gamechu. He went there, didn't make it, but that was his last wish, to have a center in Ethiopia. And the Aslan Project are the main provider. But we have also local supporters like Mulmul Braid, who is giving us nutritional support, Moe Coffee, Ethiopian Insurance Company, supporting us with medicine in Addis, and so many like ICL, International Clinical Laboratory, with DASE. They are all helping us in our activities. So, and individuals and the community basically in Addis are providing a lot of support. So it is just a lot of support that we have, and still we need more.
You need more. So but this is not a steady source of income for you, of resource, right?
Yeah.
It is not. You need to have a much more solid base, right?
We need to fundraise. We are planning to do that. So we have also St. Jude Research Hospital that has given us 10 months training on fundraising, which we will apply soon. So now we are at a point that we need to move forward from just, supporting the children. We need to think into a bigger picture.
Bigger picture meaning?
Bigger picture meaning that childhood cancer is has to be put on the agenda of Ethiopian health system.
It was up until a few years ago, that would have been 10 years ago, non-communicable disease didn't figure in the list of the Ethiopian Minister of Health, because we were more into prevention.
Yeah. But childhood cancer is not preventable. It just happens. That's the only thing is it has to be treated, and the good thing is it is curable. So now we are teaching the Ministry of Health, and they are responding very well. But we need to have a bigger campaign.
Are they also your partners?
Yeah.
In what way?
In issue of medicine, they are a great help, because they provide chemo for free, which we couldn't have afforded to have all these children in treatment. And they are also very cooperative in policy issues. Now we have a childhood cancer plan, which needs to be revised, but still it is on their agenda, and they are always there to support us. So especially regarding medicine, we have really open communication. So, yeah.
Do you feel like that you have a role to play in policy issues?
Yeah, because Tesfa Addis is a parents' organization. Nobody could understand, what's really going on in childhood cancer treatment than a parent. So we have a big role in that.
You're also peripherally trying to generate some income, I guess, by putting together some recycled materials, right?
Yeah, that is something the parents do. And what we do is there are leftover clothes from the factories. We buy it from Mercato. And now some textile factories also are donating. And we teach them how to make a mat out of it and sell it and give the money back to the parents because they need some sort of income when they stay. And it's also a therapy for them. So, and skill building as well. And we use that material, yeah. Yeah.
So in the last 10, 11 years, how many patients have you reached, you think?
More than 2,000 patients.
Sara, it was really a pleasure having you on my show. Good luck with your work. Thank you very much indeed.
Thank you for having us. Yeah, thank you.